Good morning, students. So we have been discussing about GI disorders. So as a continuation of that, today we will discuss one of the most important topic among the GI disorders, that is liver cirrhosis. You might have heard about this term or about this disease condition before, but today we will discuss in detail about this disease condition. So listen carefully, it is a very important topic. Okay. First of all, before moving on to the topic, let us remind the anatomy and physiology of liver. Okay, so liver is the body's largest internal organ, as you all know this, and it is located at the upper right hand portion of the abdominal cavity. So it is located at the upper right hand position of the abdominal cavity and beneath the diaphragm, and also on the top of the stomach, right kidney and intestine. And its shape is cone shape, and the color of liver is dark reddish brown, and its weight is approximately 3 pounds. And in liver there are two distinct blood supply are there. They are, one is hepatic artery and another one is hepatic portal vein. So these two blood supplies are the two main blood supplies of the liver. Hepatic artery carries oxygenated blood, and then hepatic portal vein carries nutrient rich blood to the liver. Okay, see, this is the front view and the back view of the liver. So if we see in front view, we will be able to see the two lobes. There are two lobes of liver, right? One is right lobe and another one is left lobe. So at the joining part of these two lobes, that is right lobe and the left lobe, there is one ligament known as falciform ligament. Okay, and then if you see in the back view, you can able to see the inferior vena cava. Inside the inferior vena cava, you will be able to see the hepatic veins, and then you can see the gallbladder also beneath the liver, that green color, and then bile duct, common bile duct. Bile duct is nothing but it is a tube. Okay, it is a tube like structure which is connected to liver as well as the gallbladder. And then you can see portal vein, then hepatic artery also. That blue color small vein is portal vein, and beside that red color hole is hepatic artery. Okay, so this is the front view and the back view of the liver. Let us see the physiology. Liver has many functions in our body. Okay, let us see one by one. Production of bile, which helps carry away waste and break down fats into small intestine during digestion. So liver, one of the most important function of liver is production of bile. Bile is nothing but it is an enzyme. Okay, it is a secretion which helps in carrying away all the waste products and break down fats which is removed out from the small intestine during the digestion. So whatever waste products or whatever fats, breakdown of fats which is excreted out from the small intestine is carried away by the bile, and bile is secreted by the liver. So this is one function. And then next is production of certain proteins for blood plasma. So in blood plasma certain proteins are there, so that those proteins are also produced by liver. and then production of cholesterol and special proteins to help carry fats through the body. So liver is also producing cholesterol and some special type of proteins which helps in carrying the fats throughout the body. And then next one is conversion of excess glucose into glycogen for storage. So whatever sugar or whatever glucose substances we eat, it will transform into glycogen, and then that glycogen will store in our body. That function is done by liver. So conversion of excess glucose into the glycogen, when we eat sugar or when we eat glucose material in excess amount, at that time those excess glucose will be converted into the glycogen in the form of glycogen, and then that glycogen will store in the liver for future use. Okay, whenever we want, whenever we need energy at that time, those stored glycogen will be used. So for the conversion of excess glucose into glycogen and then storage of that glycogen is also done by liver. And regulation of blood levels of amino acids which form the building blocks of protein. So amino acids are nothing but these are the building blocks of protein. So these amino acids are regulated by the liver in blood. Okay, and then processing of hemoglobin for use of its iron content. So not only glucose, not only glycogen, iron also stored by the liver. Okay, so iron storage is also done by liver. This is also one of the important function of liver. Then conversion of poisonous ammonia to urea. So when we eat, at that time there some poisonous substances will be there for sure. So those poisonous substances, ammonia is one of the most poisonous substances of our body. Okay, it will contain in our diet. So those poisonous substances like ammonia will be converted into the form of urea. Okay, and this conversion will be done by the liver. Okay, then that urea will be excreted through urine. So directly we cannot excrete out ammonia without conversion into urea. So this conversion is also done by liver. And then clearing the blood of drugs and other poisonous substances. As I already said, when we ingest food or whatever, any medicines or anything, so many poisonous substances will be there. So all those poisonous chemical toxic substances is mostly filtered by liver. So when we take any medicines, at that time also so many harmful chemicals will be there in those medicines and drugs. So those poisonous substances is filtered by liver. And then regulating blood clotting. So the blood clotting factors, the blood clotting mechanism is also regulated by liver. And then resisting infections by making immune factors and removing bacteria from the bloodstream. So not only filtering the toxic substances, liver is also making immune factors, okay, to prevent from infections, to resist from infections, and also remove the bacteria from the bloodstream. And next one is clearance of bilirubin, also from red blood cells. So the bilirubin which is present in the red blood cell is also filtered by the liver. So if there is accumulation of more amount of bilirubin in our body, in our blood, then there will be jaundice, okay, yellowish discoloration will be there. So maintaining the level of bilirubin by filtering the bilirubin, excess amount of bilirubin, is also done by liver. So these are the functions of liver. So next let us move on to the topic. As an introduction, the term cirrhosis was derived from Greek words Keros. So it is derived from the Greek word keros, means yellowish brown color. It is a degenerative disease in which normal liver cells are damaged. That means degenerative disease means what? A condition that gets worse as the time progresses, okay? Due to any damage in the tissue lose its function. Due to that, if the disease is occurring, then that is called as degenerative disease, okay? Degenerative disease is nothing but it is a disease condition which is getting worse more and more as the time progresses, and it is caused due to the damage in the tissue, okay? And then as a result of that, the functional ability of that particular tissue will be lost. So that is known as degenerative disease, okay? So liver cirrhosis is also one of the degenerative disease in which normal cells are damaged. So normal cells of the liver will becoming damaged and then are replaced by fibrous tissue. So the normal liver cells will be damaged, and then the healthy cells, the normal cells, will be replaced by fibrous tissues. Fibrous tissues are nothing but tissue which is already damaged beyond the recovery, okay, which is completely damaged. So those fibrous tissue will be replacing instead of healthy liver cells or healthy liver tissues in case of liver cirrhosis. And due to that, what will happen? Partially blocking the blood flow through the liver, throughout the liver, okay? So due to the replacement of the fibrous tissue in place of healthy liver tissue, blockage will be there in the blood flow throughout the liver, okay? So due to that, this liver cirrhosis is occurring. So if there is a blockage in the blood flow, then the function will not be there. The liver cannot be able to function properly. So due to that, at last liver failure will be there. This is about the liver cirrhosis. Next we will see the exact definition. First one, it is defined as a chronic progressive disease of liver characterized by extensive degeneration and destruction of the liver parenchymal cells. So as I already said in introduction also, it is nothing but it is a chronic, long term, very progressive, highly progressive, means it used to develop very fast, okay? So it is a long term progressive disease of the liver characterized by extensive degeneration, prolonged degeneration, that means degeneration means damage, okay, and destruction of the liver parenchymal cells. Parenchymal cells are nothing but those functional cells of any organ or any body, and any body parts or any organ, that is parenchymal cells. So liver parenchymal cells are the functional cells of the liver. So in liver cirrhosis, what will happen? the functional cells of the liver will be extensively degenerated, and then destruction will be there, and it is a very prolonged progressive disease of liver. Okay, and then in another definition, it is also defined as chronic disease characterized by replacement of normal cells, normal liver tissue with diffuse fibrosis that disrupts the structure and function of the liver. So it is also defined as chronic, that means prolonged disease characterized by replacement of normal tissue with diffuse fibrosis. Diffuse in a sense widespread, okay, widespread, spread all over the area. Okay, those fibrosis will occur in a very large area. Okay, so it is defined as chronic disease. It is a prolonged disease characterized by replacement of normal cell. Instead of normal cell, there will be widespread fibrosis will be there that disrupts. Because of widespread fibrosis, the structure and function of the liver will be disrupted. Okay, that is the definition of liver cirrhosis. As you can see here in this picture, in the left picture, the corner one is the left corner one is healthy liver. Okay, then next one is liver cirrhosis patient liver. So as you can see the difference, there is complete destruction of the liver. Okay, and then this is about the microscopic view of the normal cell versus liver cirrhosis cells. Okay, so first one is normal cell microscopic view. The lobule, then portal triad, then central veins will be completely normal, as you can see from the picture. But in case of cirrhosis of liver, the fibrous septa, you will be able to see the fibrous septa. Then the fatty cells will be there, that yellowish color boundaries are the fatty cells. And then necrosis. Necrosis means what? Death of cells due to any injury or damage. Okay, so this is the difference between normal healthy liver versus cirrhotic liver. Okay, then incidence. It is the 12th leading cause of death all over the world. It is the 12th leading cause of death. 27,000 deaths each year, and affects men slightly more than women. Okay, it is more in men as compared to women. Let us see the types. So mainly there are 4 types of liver cirrhosis. Okay, first one is alcoholic cirrhosis. By the name itself, you will be able to identify this. Alcoholic cirrhosis. Alcoholic cirrhosis is related to alcohol. So due to chronic alcohol abuser or alcohol consumption people, it is related to this type of liver cirrhosis. Okay, it is one of the most common type among all the types of liver cirrhosis. So it is mostly associated with the chronic alcohol use and also hepatitis C infection. Okay, and it accounts for 60 to 70% of all the liver cirrhosis. And then next one is post-necrotic cirrhosis. Post-necrotic cirrhosis accounts for 10 to 30% next to alcoholic cirrhosis. among all the liver cirrhosis, and it is caused by toxic agents secreted by the bacteria or viruses, and also it is mostly associated with the viral hepatitis. Okay, this is post-necrotic. And biliary cirrhosis. Biliary cirrhosis is caused by inflammation of the bile ducts. As we have seen in the anatomy and physiology, bile duct is connected to liver as well as gallbladder, right? So that bile duct, if there is infection or inflammation in the bile duct, then due to that inflammation, if the cirrhosis occurs, then that is called as biliary cirrhosis. Then the next one is cardiac cirrhosis. It is very rare. Okay, it is very rare type of liver cirrhosis, and it is associated with the severe right-sided long-term heart failure. So due to the right-sided long-term heart failure, if there is failure in the liver, then we will call it as cardiac cirrhosis. It is very rare. Okay, so these are the types of liver cirrhosis. Then next we will see etiology. So etiology first one is alcoholic liver disease. So alcoholic liver disease is what? Alcoholic liver disease is associated with the prolonged use of alcohol. So due to the prolonged use of alcohol, if the liver cells are damaged, then there will be a disease called as alcoholic liver disease. Okay, due to that also liver cirrhosis can occur. Okay, and then hemochromatosis. Hemochromatosis. What is hemochromatosis? Hemochromatosis is inherited hereditary genetic disease condition caused by inability to absorb the iron from food. Okay, so there will be excess iron in the blood. So due to that, a disease condition will occur that is called as hemochromatosis. So this is also one of the etiological factor of liver cirrhosis. And then next is Wilson's disease. Wilson's disease is same like hemochromatosis. Okay, here in case of Wilson's disease, what will happen? There will be inability to absorb copper. Okay, the element called copper. That copper cannot be able to absorb properly. That is why excess copper will be there in the blood. Okay, then cystic fibrosis. Cystic fibrosis is also one of the genetic inherited disorder, and which damages the lungs and the digestive system. It is a hereditary disease. Okay, so because of this also liver cirrhosis can occur. Then alpha 1 antitrypsin deficiency. So this is also one of the etiological factor. What is this alpha 1 antitrypsin? This alpha 1 antitrypsin is a protein, okay, produced by liver. So due to any genetic problem, due to inherited problem, if there is deficiency in this alpha 1 antitrypsin, then this condition will occur. Alpha 1 antitrypsin deficiency will occur. Okay, so due to this condition also liver cirrhosis can occur. Then galactosemia. So galactosemia is also an inherited disorder, genetic disorder, where the body unable to utilize the simple form of sugar called as galactose. The simplest form of sugar is known as galactose. Okay, so that galactose cannot be able to utilize by the body properly due to any genetic problem. So due to that, one condition will occur that is known as galactosemia. Okay, so in this galactosemia, more galactose will be there in the blood. Okay, excess amount of galactose will be there due to improper utilization of the galactose. Then due to this also liver cirrhosis can occur. Then glycogen storage disease. Glycogen storage disease is also known as glycogenesis or dextrinosis. Okay, it is a metabolic disorder caused by deficiency of enzymes resulting in inability to convert or metabolize the stored glycogen into glucose. As I already said in function of liver, that liver can store the glycogen. Okay, the function of storage of glycogen is done by liver. So in this glycogen storage disease, what will happen means the body cannot able to convert the glycogen into stored glycogen into glucose. Okay, due to any metabolic imbalance. Okay, so due to that disease also liver cirrhosis can occur. Then chronic hepatitis C. Okay, due to chronic hepatitis C infection also liver cirrhosis can occur. Then non-alcoholic steatohepatitis. This is an inflammation and damage caused by build up fats in the liver due to more fats in the liver, excess fats in the liver. There will be inflammation and damage of the liver. Okay, that is non-alcoholic steatohepatitis. Okay, and then due to this also liver cirrhosis can occur. Then primary sclerosing cholangitis. Okay, the term cholangitis is infection of the bile. Okay, inflammation of the bile. Okay, so a primary sclerosing cholangitis means it is a chronic disease which the bile ducts in the liver become inflamed. There will be inflammation of the bile duct in the liver, and then due to that inflammation, there will be narrowing of the bile duct, and then if there is narrowing of the bile duct, then there will not be proper flow of the bile. So at last there will be improper flow of the bile. So this is the primary sclerosing cholangitis. Due to the inflammation of the bile duct, there will be narrowing of the bile duct. Then as a result of the narrowing of the bile duct, improper flow of the bile duct will be there. That is known as primary sclerosing cholangitis. Okay, due to this also liver cirrhosis occurs. Then autoimmune hepatitis. Autoimmune hepatitis is a type of hepatitis which occurs when the body's own immune system attacks the liver cells. Okay, due to any genetic condition, due to means there is abnormality, due to the abnormality in the system of our body. Due to that, if our own immune system attacks the liver cells, at the time this autoimmune hepatitis occurs. So this is also one of the etiological factor of hepatitis, liver cirrhosis. Okay, next we will see the pathophysiology. First of all, Due to etiological factors, what will happen? Diffuse destruction and regeneration of the liver cells. So due to the etiological factors, widespread destruction will be there in the liver cells, and then after that regeneration of the liver cells will be there. So after the widespread destruction, reproduction means again the generation of the liver cells will be doing again. So then next to that, as a result of that, formation of fibrous tissue. So this time the liver cells, if the liver cells do regeneration also, the liver cells will not be normal. Only the destructed, damaged liver cells will be formed. So due to that, formation of fibrous tissue. Fibrous tissue, as I already said, fibrous tissue is the tissue which is completely damaged beyond the recovery. So there will be formation of fibrous tissue, and then due to that, destroyed liver cells are replaced gradually by scar tissue. So those distracted liver cells will be slowly replacing by the scar tissues, that is fibrous tissues. Then due to that, as necrotic tissue yields fibrosis, cirrhosis, damaged liver tissue. So due to this, necrosis will occur. What is meant by necrosis? Necrosis means death of the cell due to any damage or inflammation or injury. So necrotic tissue will be formed in the liver cells, and then what will happen? Due to that, obstruction in the blood, lymph and the bile flow. So if there is necrosis, then obviously obstruction will be there in the blood flow as well as lymph node and bile flow also. So obstruction is there in blood, lymph and bile flow, and at last hepatic insufficiency will be there. What is hepatic insufficiency? Hepatic insufficiency is nothing but the liver cannot able to function properly. Okay, that is hepatic insufficiency. So due to that, liver cirrhosis will occur. Next, we'll move on to the clinical manifestations. So clinical manifestations, here both the early and the late clinical manifestations are included. Okay, so system wise I have divided. First one we will see neurologic. Okay, in the neurological system, what will happen due to liver cirrhosis? First one is hepatic encephalopathy. Okay, so hepatic encephalopathy is nothing but it is loss of brain function due to the damage of the liver. Okay, why? Because if the liver doesn't remove the toxic blood from the blood circulation, then it will affect the brain also. Obviously it will affect the brain also. So due to the improper functioning of the liver cannot be able to remove the toxins from the blood. Due to that, loss of brain function will be there. So that is known as hepatic encephalopathy. And next one is peripheral neuropathy. Peripheral neuropathy is damages of the nerves which supplies the body's extremities like legs, hands. Okay, so nerve damages will be there which supplies the extremities. Then asterixis. What is asterixis? Asterixis means when you extended your wrist, at that time your hand will be tremor. Okay, your hand will be shivering. Okay, that is asterixis. That involuntary movement will be there liver cirrhosis. Okay, then next is gastrointestinal symptoms. We'll see anorexia, then dyspepsia. What is dyspepsia? Dyspepsia is indigestion. Due to indigestion, there will be discomfort, or there will be pain in the upper abdomen. Okay, that is dyspepsia. And nausea, vomiting, then change in bowel habits. It can be constipation, it can be diarrhea sometimes, then dull abdominal pain, then fetor hepaticus. Fetor hepaticus is a sign. Okay, so when this sign is when it will show when the liver cirrhosis is very severe. Okay, so fetor hepaticus is nothing but the breath of the patients will be very smelly. Okay, just like rotten smell will be there. Okay, the breath smell will be rotten smell, very bad smell will be there, which is just like rotten smell, rotten fish or rotten egg smell will, like that the patient breath will be feel. And why it is because when the liver is not filtering out the toxic substances at that time, all the toxic substances will be accumulated in our body. So due to that, this smell is coming out. Okay, it occurs in severe case of liver cirrhosis. Then esophageal and gastric varices. Varices is what? The term varices means enlarged veins. Okay, enlargement of the veins. So the esophageal as well as gastric veins will be enlarged. Okay, then the normal. Then hematemesis. Hematemesis means what? Blood in the vomit. Okay, blood will be there in the while vomiting. Okay, that is hematemesis. Then hemorrhageal varices. Hemorrhageal varices is what? The enlargement of the veins in the rectal area, lower rectal area. Okay, then congestive gastritis. This is also known as congestive gastropathy. Okay, so it is nothing but there will be abnormal changes in the gastric mucosa. Okay, this is the GI symptoms. Then reproductive symptoms, amenorrhea. In case of female, there will be missed periods, menstrual periods will be missed, and testicular atrophy. So this is in case of male. Testicular atrophy means shrinkage of the testis. The size of the testis will become smaller. Then gynecomastia. This is also in case of male. Gynecomastia means the increase in the breast tissue in men or boys. Okay, the breast size will becoming larger. Okay, in case of male or men or boys. Due to why it is happening? Because due to hormonal imbalance, when the testosterone, that is the male hormone, is decreasing than the normal, and when the estrogen, female hormone, is increasing, at that time this gynecomastia occurs in male. Okay, then impotence is sexual dysfunction. Okay, erectile dysfunction in case of male. So these are the reproductive symptoms. And then next is integumentary. Integumentary means in the integumentary system in skin, what will happen? What are the signs we can able to see? Jaundice, you all know that hyperpigmentation of the skin due to bilirubin, increase bilirubin, excess amount of bilirubin. Then spider angioma Spider angioma is nothing but, as you can see in this picture, in the first picture, it will look like this. Okay, so it is the enlargement of the blood vessels in any body part, in any area. So it can be due to any injury, sun exposure, or due to hormonal changes, or due to liver disease also it can occur. Okay, just like a spider, there will be in the center, there will be blood clot like red spot will be there, and then from there so many branches will be extended. Okay, that is spider angioma. Then palmar erythema. So palmar erythema is nothing but, you will see redness in both the palm of your hands. Okay, as you can see from this picture, the second picture. Then purpura. Purpura is nothing but, it is red or purple discoloration. Okay, there will be spots in red or purple on the skin, which is caused by bleeding underneath the skin. Okay, why the purple or reddish discoloration is there? Because of bleeding underneath the skin, secondary to platelet disorders or any coagulation disorders. Okay, this one first picture is purpura. Okay, and then next is petechia. Petechia is also tiny flat round brown, red or purple spots on the skin. Okay, it is also due to bleeding underneath the skin, same like purpura. Okay, here as you can see in the second picture, middle picture. Okay, so this is petechia. And then next one is caput medusa. Caput medusa is the appearance of distended epigastric vein. The epigastric veins will be distended, and that distension can be able to see from outside. Externally we can able to observe that distended epigastric vein all across the abdomen. Okay, see the third picture, as you can see the veins, enlargement of the veins, distension of the vein, these are the epigastric veins. Okay, so this is also one sign in later, means later sign of liver cirrhosis. Okay, in case of severe liver cirrhosis you can see this. So next is hematologic. So what will happen, what are the clinical manifestations you can see in hematologic system due to liver cirrhosis? First one is anemia. Anemia you can see, and then thrombocytopenia. Thrombocytopenia means what? Decrease platelet count. Okay, less than normal. Then leukopenia. Leukopenia means decreased white blood cells, less than normal. Then coagulation disorders. So coagulation disorders like hemophilia will be there. Okay, then splenomegaly. Splenomegaly is what? Enlargement of the spleen. This is also you can see in case of severe liver cirrhosis. Okay, next is metabolic. In case of metabolic process, what will happen, means what are the metabolic symptoms you can able to see, these metabolic disorders. In case of liver cirrhosis, hypokalemia and hyponatremia. Okay, hypokalemia means decreased potassium level, then hyponatremia means sodium. Okay, decreased sodium. Then later clinical manifestations. So all these later clinical manifestations, most of them I have already mentioned before in systemic wise, but still let us remind once again. Later clinical manifestations are the manifestations which you can see in severe case of liver cirrhosis. Okay, jaundice you can see. Then esophageal varices, as I have already mentioned before, it is enlargement of the vein of esophagus. Then ascites. What is ascites? Ascites means accumulation of fluids in the peritoneal cavity. This is also late clinical manifestation in case of severe liver cirrhosis. Then hepatomegaly, enlargement of the liver. Then splenomegaly, enlargement of the spleen. Then hemorrhoids. Hemorrhoids means swollen veins of the rectum. Then edema, you will be able to see the edema. Then change in the mental responsiveness and memory. So there will be alteration in the mental responsiveness and memory. Then collateral veins visible on abdominal wall. This is also that caput medusa, as I have already discussed before. And then anemia, then thrombocytopenia, then peripheral neuropathy, I already mentioned before. So these are the later clinical manifestations. That means you can see these manifestations in case of severe liver cirrhosis. Then let us see diagnostic evaluations: history collection, physical examination, liver biopsy, then ultrasound, then endoscopy, MRI, CT scan, X-ray, liver function test, complete blood count, serology for hepatitis viruses, autoantibodies, then immunoglobulin levels like IgG, IgM, IgA should do. So the picture you are seeing now on the right side is liver biopsy. Okay, so these are the diagnostic evaluations you need to do for liver cirrhosis. Next, we will see the medical management. Medical management, first one, to prevent from infection, we have actually medical management, we have to do symptomatic treatment. Okay, if there is infection, if the liver cirrhosis is caused by any infection, then we have to give antibiotics like cephalosporin, or in case of viral hepatitis, then antiviral medications you have to give. Then potassium sparing diuretics, spironolactone, that is allectone, we have to give. Why? Because to reduce the ascites as well as to reduce the pleural effusion. Then lactulose, used to eliminate the ammonia from the blood into the bowel. Okay, so to remove out the ammonia which is accumulated in the blood, by giving lactulose, we can eliminate out into the bowel. Then tap water enemas may be also be ordered to help the body eliminate the ammonia. So to remove the ammonia, enema and lactulose you can give. Then propanolol hydrochloride, that is Inderal, an antihypertensive medication may be ordered to lower the portal hypertension. So portal hypertension is a condition. Okay, it is a complication of liver cirrhosis. I will discuss later, okay, in complications. So to reduce that portal hypertension, we will give propanolol hydrochloride, that is Inderal. Then hepatic encephalopathy, for hepatic encephalopathy we can give neomycin, that is 1 mg 6 hourly, metronidazole 250 mg 8 hourly. Then we can also give antacids, then for indigestion. Okay, then corticosteroids we can give, but we have to avoid NSAIDs. Okay, non-steroidal anti-inflammatory drugs we have to avoid in case of liver cirrhosis. Then next we will see the surgical management. So surgical management is in first surgical management, transjugular intrahepatic portosystemic shunt. Okay, shunt, what is meant by shunt? Shunt is nothing but it is a hollow tube which is made surgically. Okay, surgically made hollow tube placed in order to move, or in order to allow the fluid from one part to another part of the body. So it is nothing but it is an artificial hollow tube which is made surgically in order to allow, or in order to move fluid from one part of the body to another part of the body when there is obstruction. Okay, that is shunt. So transjugular intrahepatic portosystemic shunt is also one type of shunt. Is a shunt placed between the portal vein. So this shunt will keep between the portal vein and the hepatic vein. Okay, so there is obstruction in the blood flow. As I already said in pathophysiology, there is obstruction in the blood flow inside the liver. So due to the obstruction, this shunt is needed between the portal vein and the hepatic vein. Okay, then distal splenorenal shunt. It is also a surgical procedure in which the vein from the spleen is detached from portal vein and reattached to the kidney vein. So it is nothing but it is also a surgical procedure where the splenic vein, that means the vein of the spleen, will be detached. That means they will cut the splenic vein from the portal vein, then they will, that cut part will reattach to the left kidney vein. Okay, it reduces the pressure in varices. So as I already said, in liver cirrhosis, varices is one of the most common clinical manifestation, right, enlargement of the veins. So to reduce that, to reduce the pressure in the veins, this distal splenorenal shunt is doing. So they will cut the vein of the spleen, and then they will bring back that spleen and then reattach that splenic vein to the left kidney vein. Okay, and also controls the bleeding and clotting. Then next one is sclerotherapy. Sclerotherapy is effectively treats varicose and spider veins. So as I already said in clinical manifestation, varices and spider vein, as I mentioned before, to reduce that varices and to reduce that spider vein, we will give this sclerotherapy. Okay, it involves injecting a solution, causes the vein to scar, forcing blood to reroute through healthier veins. The collapsed vein is reabsorbed into the local tissue and eventually fades. So here what will happen means they will inject one solution. Okay, so they will inject one solution into the vein that which is already scarred. Okay, then forcing the scarred vein to reroute through healthier veins. So to connect to the healthier vein, they will force the scarred vein by injecting one solution, and then after connection, the scarred tissue or the collapsed vein will be automatically die. Okay, death will occur, death of that particular tissue will occur. Okay, then it will remove out in the excretion. Okay, so this is sclerotherapy. This sclerotherapy procedure, I'll show you this procedure in one video. Okay, you see that video, you will be able to understand easily if you see that video. Then liver transplantation is also one choice of treatment for liver cirrhosis, and it is a surgical procedure that removes a liver that no longer function properly. So it can be part of a liver or the whole liver we can remove. Already damaged liver we will remove and then replace it with a healthier liver from a deceased donor. So from a deceased donor means death donor, we will remove out the whole liver and then we will replace it, or a portion of a healthy liver from the living donor. We can take a small portion of the healthy liver from a living donor also we can take, and we can replace in that particular damaged liver. Okay, and then that small portion of healthy liver will regrow again and function as a normal liver again. So liver transplantation is also one of the surgical management of liver cirrhosis. Then next one is paracentesis. Paracentesis is removal of fluid from the peritoneal cavity. Okay, so to remove the fluid from abdomen and relieve pressure on the diaphragm and lungs. So why the paracentesis is doing? Because to reduce the ascites, okay, accumulation of fluid, to remove the accumulation of fluid in the peritoneal cavity so that the pressure on the diaphragm and the lungs can relieve. Okay, and then paracentesis is done by making a small incision and inserting a trocar into the abdomen to drain the fluid. So it is done by inserting a trocar, that is a tube, and then by making a small incision into the abdominal cavity to drain out the fluid. And albumin may also be infused at the same time to pull excess fluid back into the vascular system. So not only removing the fluid but can also infuse albumin so that the excess fluid can pull back into the vascular system. Okay, then complications: bruising and bleeding. Bruising means what? Scarring of the tissue. Then bleeding can occur. Then jaundice is also one complication. Then hepatic encephalopathy, as I already mentioned before. Then hepatocellular carcinoma, it is cancer of liver. Okay, then portal hypertension. Portal hypertension means what? Portal hypertension means increased blood pressure within the portal vein. Okay, so the blood pressure of the portal vein will be increased, and portal vein is nothing but the vein which carries blood from digestive organs to the liver. So these particular veins blood pressure will be increased abnormally. This is a very dangerous condition. Okay, so due to liver cirrhosis this portal hypertension can occur. So these are the complications. Nursing management, activity intolerance related to fatigue, lethargy, malaise. Then imbalanced nutrition related to abdominal distension and discomfort, impaired skin integrity related to pruritus or from jaundice and edema. Then high risk injury injury related to altered clotting mechanism and altered loss of consciousness. Then fluid volume excess related to ascites and edema formation. Okay, so these are some of the interventions you can give. Monitor vital signs, intake output and electrolyte levels. Then maintain some periods of rest with legs elevated to mobilize the edema and ascites. Then assess the fluid retention, measure and record abdominal GERD every shift. and weight the patient daily and document his weight. Then administer diuretics, potassium, protein, then or vitamins, supplements as ordered. Restrict sodium and fluid intake as ordered. Then observe and document for bleeding gums, ecchymosis, epistaxis, petechia, and degree of sclera, skin jaundice. Then inspect stools for amount, color, consistency. Then watch for signs of anxiety, epigastric fullness, then general weakness. Then observe closely the signs of behavioral or personality changes. If there is any change, then you should report. Then allow the patient to express his feelings of having cirrhosis, okay, and psychological support and encouragement should be given. Then patient teaching. To minimize the risk of bleeding, warn the patient against taking non-steroidal anti-inflammatory drugs, NSAIDs. Straining to defecate, patient has to avoid straining while defecating and blowing his or her nose while sneezing, and suggest using an electric razor or a soft toothbrush to prevent from bleeding. Advise patient that rest and good nutrition conserve energy, decrease metabolic demands on the liver, and urge him to eat frequent small meals, and also teach him to alternate periods of rest activity to reduce oxygen demand and prevent fatigue. Okay, these are the patient teaching. So this is about the liver cirrhosis. If you have any doubt, let me know.